Just like a camera, the eye has a lens within it which helps it to focus light and helps you to see clearly. With age and time, the lens becomes cloudy and we call that a cataractous lens. For short, it's called a cataract. At this moment in time, the only treatment that we have for cataract is a cataract operation. And that involves removing the lens from the eye and replacing it with an artificial lens. We can vary the type of lens that we place in the eye, and some people may choose to have a multifocal lens, while others have monofocal lenses. So on the day, most patients who come in for cataract surgery will have a local anesthetic, so they will have a very fast recovery. The procedure itself will take 15 minutes or so, and patients can leave for home pretty much soon afterwards. Patients usually have a really positive outcome following cataract surgery. I'll often have patients who've come back and say that they didn't realize what they were missing, that they can see blades of grass individually, they can see the flowers in their garden much more clearly, and even the colors of the clothes that they're wearing are so different to what they'd imagined before. Most people will develop cataract in their lifetime, and many people will have cataract surgery in order to address the problems that are being caused by cataract. It's a relatively simple procedure with a low risk of complications, and the benefits from cataract surgery far outweigh the risks for most patients.